Anxiety disorders, what are they? It is normal to feel anxious. Stress triggers your brain to alert you that there may be danger ahead. There are times when everyone feels anxious. When faced with a problem at work, taking a test, or making an important decision, you might worry. Occasional anxiety is okay. But anxiety disorders are different. These disorders cause constant anxiety and fear. You might avoid work, school, family get-togethers, and other social situations because of excessive anxiety. With treatment, many people with anxiety disorders can manage their feelings. Types of anxiety disorders. There are several types of anxiety disorders. Number 1, generalized anxiety disorder. With little or no reason, you feel excessive, unrealistic worry and tension. Panic disorder. An attack of panic is triggered by sudden, intense fear. During a panic attack, you may sweat, experience chest pain, and experience palpitations. Some people feel as if they are choking or having a heart attack. Social anxiety disorder. Also called social phobia, this is when you feel overwhelming worry and self-consciousness about everyday social situations. Whenever you think that others will judge you, embarrass you, or ridicule you, you obsessively worry about it. Specific phobias. When you fear a certain object or situation, for example heights or flying, you feel intense fear. You may avoid ordinary situations because of the fear that goes beyond what's appropriate. Agoraphobia. An intense fear of being in a place where it is difficult to escape or get help in case of an emergency. For example, you may panic or feel anxious when on an airplane, public transportation, or standing in line with a crowd. Separation anxiety. When a loved one leaves, it's not just little kids who get sad or frightened. Anyone can suffer from separation anxiety. If you don't, you'll be frightened whenever a close friend or family member is out of your sight. You'll never be able to stop worrying about what might happen to someone you care about. Selective mutism. This is a form of social anxiety in which young children who normally talk with their family do not speak in public, such as at school. Medication-induced anxiety disorder. Certain medications or illegal drugs, as well as drug withdrawal, can cause some symptoms of anxiety disorder. Anxiety disorder symptoms. Excessive fear or worry is the primary symptom of anxiety disorders. Anxiety disorders can make it difficult to breathe, sleep, remain still, and concentrate. The specific symptoms you experience are determined by the type of anxiety disorder you have. Some causes of anxiety disorders are genetics. Anxiety disorders can run in families. Brain chemistry. According to some research, anxiety disorders may be caused by faulty circuits in the brain that control fear and emotions. Environmental stress. This refers to stressful events that you have witnessed or experienced. Childhood abuse and neglect, the death of a loved one, or being attacked or witnessing violence are all common triggers for anxiety disorders. Drug withdrawal or misuse. Certain drugs can be used to mask or reduce anxiety symptoms. Anxiety disorder is frequently associated with alcohol and substance abuse. Medical conditions. Some heart, lung, and thyroid disorders can mimic or worsen anxiety symptoms. It's critical to get a full physical exam to rule out any potential problems. Add other medical conditions when talking to your doctor about anxiety. Risk factors for anxiety disorder. Some factors also increase your chances of developing an anxiety disorder. These are called risk factors. Some risk factors are unchangeable, while others are. Risk factors for anxiety disorders include History of mental health disorder. Having another mental health disorder, like depression, raises your risk for anxiety disorder. Trauma. Living through a traumatic event increases the risk of post-traumatic stress disorder, PTSD, which can cause panic attacks. Negative life events. Stressful or negative life events, like losing a parent in early childhood, increase your risk for anxiety disorder. Severe illness or chronic health condition. Constant worry about your health or the health of a loved one, or caring for someone who is sick, can cause you to feel overwhelmed and anxious. Substance abuse. The use of alcohol and illegal drugs makes you more likely to get an anxiety disorder. Some people also use these substances to hide or ease anxiety symptoms. Being shy as a child. Shyness and withdrawal from unfamiliar people and places during childhood is linked to social anxiety in teens and adults. Low self-esteem. Negative perceptions about yourself may lead to social anxiety disorder. Anxiety disorder diagnosis. If you have symptoms, your doctor will examine you and ask questions about your medical history. They may run tests to rule out other health conditions that might be causing your symptoms. No lab tests can specifically diagnose anxiety disorders. If your doctor cannot find a physical cause for your symptoms, he or she may refer you to a psychiatrist, psychologist, or another mental health specialist. These doctors will ask you questions and conduct tests to determine if you have an anxiety disorder. When diagnosing you, your doctors will consider how long you've had symptoms and how severe they are. It's critical to notify your doctors or counselors if your anxiety makes it difficult to enjoy or complete daily tasks at home, work, or school. Screening for anxiety in children and adolescents aged 8 to 18 years, and screening for major depressive disorder, MDD, in adolescents aged 12 to 18 years, is recommended by the U.S. Preventive Services Task Force. Anxiety disorder treatments. There are numerous treatments available to help reduce and manage the symptoms of an anxiety disorder. Usually, people with anxiety disorder take medicine and go to counseling. Treatments for anxiety disorder include medication. Several types of drugs are used to treat anxiety disorders. Talk to your doctor or psychiatrist about the pros and cons of each medicine to decide which one is best for you. Antidepressants. Modern antidepressants, SSRIs and SNRIs, are typically the first drugs prescribed to someone with an anxiety disorder. Examples of SSRIs are escitalopram, Lexapro, and fluoxetine, Prozac. SNRIs include duloxetine, Cymbalta and venlafaxine, Effexor. Bupropion. This is another type of antidepressant commonly used to treat chronic anxiety. It works differently than SSRIs and SNRIs. Other antidepressants. These include tricyclics and monoamine oxidase inhibitors, MAOIs. They are less commonly used because side effects, like drops in blood pressure, dry mouth, blurry vision, and urinary retention, can be unpleasant or unsafe for some people. Benzodiazepines. Your doctor may prescribe one of these drugs if you're having persistent panicky feelings or anxiety. They help lower anxiety. Examples are alprazolam, Xanax, and clonazepam, Klonopin. They work quickly, but you can become dependent on them. Usually, they're meant to be an add-on to your anxiety disorder treatment and you shouldn't take them for a long time. Beta blockers. This type of high blood pressure drug can help you feel better if you're having physical symptoms of anxiety, such as a racing heart, trembling, or shaking. A beta blocker may help you relax during an acute anxiety attack. Anticonvulsants. Used to prevent seizures in people with epilepsy, These drugs also can relieve certain anxiety disorder symptoms. Antipsychotics. Low doses of these drugs can be added to help make other treatments work better. Buspirone, Buspar. This anti-anxiety drug is sometimes used to treat chronic anxiety. You'll need to take it for a few weeks before seeing full symptom relief. Psychotherapy is a type of counseling that teaches you how your emotions influence your behavior. It's also known as talk therapy. A trained mental health professional listens to and discusses your thoughts with you and feelings and suggests ways to understand and manage them and your anxiety disorder. Cognitive behavioral therapy, CBT, is a type of psychotherapy that teaches you how to change negative, or panic-inducing, thoughts and behaviors into positive ones. You'll learn how to approach and manage fearful or worrying situations without becoming anxious. Some locations provide family CBT sessions. Managing anxiety disorder symptoms. These tips may help you control or lessen your symptoms. Learn about your disorder. The more information you have, the better prepared you will be to deal with symptoms and roadblocks along the way. You should not be afraid to ask your doctor any questions you may have. Remember that you are an important member of your healthcare team. Maintain your treatment plan. Stopping your medications abruptly can result in unpleasant side effects and even anxiety symptoms. Caffeine-containing foods and beverages, such as coffee, tea, cola, energy drinks, and chocolate, should be avoided. Caffeine is a mood-altering drug that may exacerbate the symptoms of anxiety disorders. Don't use alcohol or recreational drugs. Substance abuse increases your chances of developing anxiety disorders. Eat healthily and exercise regularly. Aerobic exercises, such as jogging and biking, help release brain chemicals that reduce stress and improve mood. Improve your sleeping habits. Sleep issues and anxiety disorders frequently coexist. Make adequate rest a priority. Maintain a soothing bedtime routine. If you're still having trouble sleeping, consult your doctor. Learn to unwind. Stress management is an essential component of your anxiety disorder treatment strategy. Meditation, or mindfulness, can help you unwind after a stressful day and may improve the effectiveness of your treatment. Maintain a journal. Writing down your thoughts before bedtime may help you relax and avoid tossing and turning all night with anxious thoughts. Control your negative thinking. Anxiety can be reduced by thinking positive thoughts instead of worrying ones. This can be difficult if you suffer from certain types of anxiety. Cognitive behavioral therapy can teach you how to change your mind. Gather with your friends. Social connections, whether in person, on the phone, or on the computer, help people thrive and stay healthy. People with a close circle of friends who encourage and converse with them have lower levels of social anxiety. Seek assistance. Some people find it beneficial and uplifting to talk to others who are going through similar symptoms and emotions. Self-help or support groups allow you to share your concerns and accomplishments with others who are or have been in your shoes. Before using any over-the-counter medications or herbal remedies, consult your doctor or pharmacist. Many contain chemicals that can exacerbate anxiety symptoms. Anxiety disorder outlook. Living with an anxiety disorder can be difficult and frustrating. Constant worry and fear can exhaust and frighten you. If you've discussed your symptoms with a doctor, you've taken the first step toward letting go of your anxiety. Finding the right treatment that works for you can take some time. If you have more than one anxiety disorder, you may require a combination of treatments. Most people with anxiety disorders benefit from a combination of medication and counseling. You can learn to manage your symptoms and thrive with the right care and treatment.